Hi, I'm Dr. Asghar Husain, orthopedic surgeon. Joining me is Krista Consiglio-Lahti, physical therapist from Arrowhead Orthopedics. We're going to talk about a very simple recommendation for how do you use your hand, wrist, and elbow when you have a shoulder surgery, when you have a rotator cuff surgery. You want to text, you want to eat, you want to brush your teeth. So Krista, can you demonstrate using Matt here? How would you do that using this sling as a guide?
So as far as using it for daily functional stuff, I let them tell them you can like hold your fork, but you're going to have to cut with the opposite hand if it's your non-dominant hand. Eating, still eat with the opposite side.
Yep.
Keep this nice and relaxed. I do want to get the movement though. I ask them a couple times a day just to take their hand out, and they can just fold this part back or take the sling off and sit on a couch. But I want to see that hand moving. I want to get the wrist moving up, down, in, out. That way the wrist doesn't get stiff. I want to protect the other joints as well. The last thing you want is to protect the shoulder so much that everything else freezes up as well. Most slings come with a squeeze ball, so they can either leave it in there or take it out and then, a few times a day, squeeze the ball, keep the blood flowing. I also ask them to stretch their neck, both sides. The neck gets pulled on a ton by the sling. You're sleeping in it, you're walking in it, you're doing life in it, and both sides of the neck will tighten up. So I'll have them stretch their neck to the side, and I'll also have them just turn and look down towards their armpit to kind of get the muscle behind the shoulder blade as well, that levator scap muscle that kind of tends to pull on the neck. We'll also pull on the shoulder blade, pull on the shoulder, make everything else a little bit uncomfortable. Last one I want is to protect that elbow. So I'll have them take their hand out of the sling completely. They can leave everything on and just unclip this part. And then with their other hand, let me get this part out of there for you. Just go ahead and grab your wrist.
Take this knife over here, yep.
And then lifting it up, not the way he just did using his shoulder, but using this hand to do all the supporting.
Yep, so we want to go passive, so you're going to relax the upper trap just
Correct.
like that. Yep.
And now with that other hand, just lower that elbow down.
So you're resting it on the outside of the pillow, leaving
Correct.
the pillow there.
Correct. And then just bend it back up. Get that full range of the elbow. Don't lock the elbow out. Let it stay a little bit bent at the bottom, just in case some other repairs were done. But I want to keep the movement in that elbow as well. If you stay in that position for the 4 to 6 weeks, that elbow is really stiff, and getting that one loosened up later is a little tricky.
Yep, sounds good. And then we slowly get back in the sling and business as usual.
Correct.
All right, perfect.